Dr. Harwell's hands shot out and swept the entire tray off the bedside table. Medications, charts, water cup, everything crashing to the floor in one savage motion. "He is gone!" he snarled, turning on the trembling young nurse who had dared to question him, his fingers stabbing the air inches from her face. "You touch his file again, I will have your license shredded by Friday." He grabbed Kyle Merritt's chart, flipped to the last page, and scrawled 4 words in red ink so hard the pen tore through the paper. "Do not resuscitate. Recommended." Then he slammed it shut. The Admiral's son still had a heartbeat, and this man just signed his ending. Subscribe. Drop your city below. Don't you dare leave. The morning Dana Collier walked into the James A. Haley Veterans Hospital in Tampa, Florida, it was raining. Not the dramatic kind of rain that movies use to signal that something important is about to happen. Just steady, gray, stubborn rain. The kind that soaks through your jacket before you realize it's doing it. She carried a single bag over one shoulder, her badge clipped to her scrub pocket, her hair pulled back tight and clean. She moved through the front lobby the way people move when they know exactly what they're walking into and have already decided they're not afraid of it. She had requested this assignment. That was the first thing the charge nurse, Patricia Owens, noticed about her. In 22 years of running this floor, Patricia had never once had a traveling nurse request the VA. Not this VA, not the long-term care wing, not Ward 7, which the staff had quietly started calling the last mile, because that's what it felt like. You got sent to Ward 7 when the conversation had shifted from recovery to management. When the goal was no longer about getting better, it was about making the end as quiet as possible. Dana had specifically asked for Ward 7. Patricia looked at her intake paperwork, then looked up at the woman standing in front of her and said, "You know what floor this is?" "I do," Dana said. "You know what kind of patients we carry here? Long-term unresponsive, persistent vegetative cases, a few minimally conscious, some traumatic brain injuries that didn't respond to intervention." She said it the way a carpenter describes the wood they prefer to work with. Not cold, just precise. Patricia studied her for a long moment. "Where were you before this?" "Bethesda. Before that, Landstuhl Regional in Germany. Before that, I was forward deployed with a Special Operations Support Unit in Afghanistan. 2 tours. Patricia set down the paperwork. "And you want Ward 7? "Yes, ma'am." That was the beginning. And if Patricia Owens had known, in that moment, what the next 6 weeks were going to look like, she might have said something different. She might have warned Dana. She might have told her about Dr. Harwell, about the Admiral, about the boy in room 712, about all of it. But she didn't know yet. So she just handed Dana her assignment sheet and said, "Orientation is down the hall. Don't be late." Dana was not late. She was, in fact, 15 minutes early. Room 712 was not the first room Dana saw on her first day. She had 4 other patients assigned to her. A veteran from the Gulf War with a slow bleed they were managing conservatively. A young Marine who had come home from Kabul with a spinal cord injury and had recently been downgraded to palliative. A former Navy corpsman with advanced stage ALS, and a retired Army sergeant who had been found unresponsive in his apartment 3 months ago after a stroke that his family hadn't known he'd survived. Dana tended to all of them with the same focused attention, checking lines, updating fluid assessments, sitting quietly for a moment beside each man, as if she was taking inventory not just of their vitals, but of something else, something harder to chart. It was on her second pass down the hall just after noon when she stopped in front of room 712. She hadn't been assigned to this room. The patient inside, Kyle Merritt, 26 years old, formerly attached to a SEAL training command, was under the primary care of Dr. Harwell and attended by a rotating set of nurses who had, over 4 months, developed a particular kind of professional distance that is really just another word for grief. You stop seeing a patient when seeing them hurts too much. You stop expecting anything, and eventually the chart becomes the person. Dana stood in the doorway. She didn't go in. She just looked. Kyle Merritt lay in his hospital bed, connected to a ventilator, a feeding tube, a catheter, and a bank of monitors that beeped with the steady indifference of machines doing their job. His face was young. Even with the equipment, even with the pallor of 4 months in a hospital bed, he was clearly young. His hair had been shaved close on the sides. Someone had done that recently, kept it neat, which meant someone still cared enough to come in and see to small dignities like that. Dana noticed that. She filed it away. She was about to move on when she saw it. It was nothing. It was so small that if you blinked, you would have sworn you imagined it. A contraction, not a spasm, not a reflex arc, but something with a quality that was different. It lasted less than a second. The ring finger on his left hand. A slight curl inward, then release, then nothing. Dana did not move. She stood very still, the way she had learned to stand still in places where movement cost you something. She watched for 2 full minutes. Then she stepped into the room, pulled out her pen light, and leaned over the bed. "Can you hear me?" she said quietly. The monitors beeped. The ventilator breathed. Nothing happened. She straightened up, clicked off the pen light, and stood there a moment longer. Then she picked up his chart from the hook at the end of the bed and opened it. She read for 6 minutes. She read everything, every note, every assessment, every nursing shift report going back to the day Kyle Merritt had been brought in after a training dive went wrong, a decompression event that had left him without oxygen for an estimated 4 minutes before his dive partner got him to the surface. She read Dr. Harwell's notes. She read the neurology consult from week 2. She read the ethics committee summary from month 3, the one that gently, carefully, in the language that committees use when they want to soften something hard, had begun to move toward a conversation about withdrawal of care. She put the chart back on the hook. She looked at Kyle Merritt for another 10 seconds. Then she walked out, continued her rounds, and did not say anything to anyone for the rest of the day. That night, in the small apartment the hospital had arranged for her as part of her traveling contract, Dana opened her personal laptop and pulled up a research paper she had saved 3 years ago. It was from the Journal of Neurotrauma, a study on what the researchers called covert awareness, the presence of measurable cognitive activity in patients whose outward presentation met all clinical criteria for vegetative state. The study had used functional MRI to detect responses to commands in patients who showed no behavioral signs of consciousness. The results had been cautious, hedged, qualified in the way academic papers always are, but the implication was devastating in its simplicity. Some patients who appeared to be gone were not gone at all. Dana had first read that paper in a tent in Kunar Province, Afghanistan, by the light of a headlamp at 2 in the morning after a day that she was not going to think about right now. She had read it because of a man named Corporal Eddie Reyes, who had been found unresponsive after an IED blast and who the battalion surgeon had classified as unsurvivable. Dana had disagreed. She had done something that was not in any protocol, was not sanctioned, was in fact specifically against what she'd been told, and she had sat with Eddie Reyes for 11 hours and talked to him, tested him, used a technique she had developed through a combination of reading, intuition, and the particular kind of stubbornness that keeps certain people from accepting endings they don't believe in. Eddie Reyes had walked out of the Landstuhl Hospital 14 weeks later on his own 2 feet. She closed the laptop. She set her alarm for 5:15. She went to sleep. The next morning, Dana arrived on Ward 7 at 5:50. The overnight nurse, a young man named Trevor who looked like he hadn't slept in 2 days and hadn't, gave her a brief handoff and headed for the exit with the air of a person escaping. Dana made her rounds, did her checks, and at 6:40 was standing in the doorway of room 712 again. This time she went in. She didn't touch anything. She pulled the chair from the corner of the room and placed it beside the bed, close but not crowding, and she sat down. She looked at Kyle Merritt's face. She looked at his hands. She looked at the way his chest rose and fell with the help of the ventilator. A rhythm that was machine-made, but still, somehow, the rhythm of a living person. "My name is Dana," she said, quietly, conversationally. "I'm a nurse. I just started here. I'm not your assigned nurse. I just noticed you yesterday, and I wanted to come back." She paused. "I've met a few people in situations like yours. I want you to know that I'm not going to talk at you like you can't hear me. I'm going to talk to you like you can. Because I think maybe you can. I don't know yet, but I'm going to find out." She watched his face. His chest rose, his chest fell. Then the ring finger on his left hand moved again. The same slight inward curl. Release. Dana leaned forward in her chair. "Do that again," she said, low, direct. The voice she used to use when she needed someone to focus through the noise. "If you can hear me, do exactly what you just did. Move your finger." 5 seconds. 10. The finger curled. Dana exhaled a breath she hadn't realized she was holding. She sat back. She pressed her hand flat on her own thigh to keep it from shaking. "Okay," she said, her voice still steady. "Okay, I hear you." She went directly to the nurse's station after that and pulled up Kyle's file in the system. She made a notation, careful, clinical, documented with the precision she'd been trained to have, because she knew already that what she was about to do was going to be disputed. She wrote that she had observed what appeared to be a volitional motor response, differentiated from reflex by its repetition and apparent correlation with verbal stimulus. She noted the time, the duration, the laterality. She noted that it warranted further assessment. Then she went to find the charge nurse. Patricia Owens read Dana's notation with the expression of someone who has seen enthusiastic new nurses make observations before. Not unkind, just careful. "Have you reviewed Dr. Harwell's assessment?" she asked. "Yes." "And the neurology consult?" "Yes." "Dana," Patricia's voice was gentle, which was somehow worse than if it had been hard. "This patient has been assessed by 3 neurologists and the attending. The family has been in consultation with the ethics team. There are," she paused, chose her words, "there are very serious conversations happening about Kyle's care." "I know," Dana said. "I think those conversations are happening based on incomplete information." Patricia studied her. "That's a significant thing to say." "I know that too." The door at the end of the hallway pushed open, and Dana heard the sound before she turned to see the source of it. The sound of a man whose footsteps carry the weight of someone who has spent decades being heard before he speaks. She turned. He was tall, late 60s, maybe early 70s. Silver hair cut military short. He wore civilian clothes, a button-down shirt, dark slacks. But he wore them the way military men always wear civilian clothes, which is to say, slightly incorrectly, with a straightness of bearing that civilian clothes weren't designed for. He carried a paper coffee cup in one hand and nothing else. His face was the face of a man who had mastered control of his face and was currently losing that battle. Rear Admiral Thomas Merritt walked down the hall of Ward 7 like he had the right to be there, because he had been coming here every single morning for 4 months. And if that didn't give him the right, then nothing did. Patricia straightened slightly. "Admiral, good morning." He nodded once, his eyes moving to Dana, assessing her, cataloging her, the way men like him always catalog people they didn't recognize in places they considered their territory. "New," he said. "Yes, sir," Dana said. "Dana Collier. I started 2 days ago." "You're not Kyle's nurse." "Not officially, no." Something in the way she said it made him stop walking. "What does that mean?" Patricia stepped in. "Admiral, Dana is one of our traveling nurses. She was just—" "I made a notation on Kyle's file this morning," Dana said. "I observed what I believe are volitional responses that haven't been documented in his recent assessments. I think there are grounds for a reevaluation." The hallway was very quiet for a moment. Admiral Merritt's jaw moved. It was a small movement, the jaw of a man processing something that was trying to be hope and fighting not to be, because hope had cost him too much already in this corridor. "What kind of responses?" he said. It wasn't quite a question. Finger movement correlated with verbal commands, repeatable, bilateral inhibition on the non-responding side. It's subtle, but it's there. He looked at Patricia. Patricia looked at him with an expression that was carefully, professionally neutral. "I want Dr. Harwell," the Admiral said. "Admiral, Dr. Harwell may have a different—" "I want Dr. Harwell," he said again. Not louder, just more finished. Dr. Harwell arrived at Ward 7 at 8:15. He came in fast, in that particular way that busy physicians move when they've been interrupted from something they consider more important. And the first thing he did was look at Dana with the careful blankness of a man who has already decided what he thinks before the conversation begins. He was mid-50s, thin in the shoulders, with the eyes of someone who had been disappointed by medicine long enough that he'd started to take it personally. He read the notation. He read it standing at the nurse's station, with the Admiral 10 feet away and Dana standing beside Patricia with her hands loose at her sides. "This is a reflex," Harwell said. He didn't look up from the chart. "I don't believe it is," Dana said. Now he looked up. "I'm sorry?" The response was elicited by verbal command. It was reproducible. The quality of the movement is inconsistent with reflex arc. There's a latency to it that— "Miss Collier," he set the chart down. "I appreciate that you're new here and that you haven't had the chance to review the full clinical picture. Kyle Merritt has been assessed extensively. His diagnosis has been confirmed by multiple neurologists. What you observed was a spontaneous motor event. It happens in vegetative patients. It does not indicate consciousness." "I asked him to move his finger," Dana said, "and he moved it." The silence that followed had a texture to it. Admiral Merritt took one step forward. One step. "What did you just say?" His voice was barely above a whisper, which was more frightening than shouting. Harwell turned toward the Admiral quickly. "Sir, I want to be honest with you, because I respect you and I respect your son's service. Did she just say that my son moved his finger when she asked him to?" "What she observed." "Did she say that?" Harwell's jaw tightened. "She made an observation that she interpreted as—" "I'm not asking for your interpretation of her interpretation." The Admiral's voice had gone flat and precise, the voice of a man who had given orders from carrier decks in the middle of the Pacific, who had planned operations in rooms that most people didn't know existed. "I'm asking what she said." Dana spoke. "I sat with your son this morning, Admiral. I spoke to him. I told him that if he could hear me, to move his finger. He moved it. I asked him again. He moved it again." She paused. "I have documented it in the chart. I believe it warrants a formal reassessment by an independent neurologist." Admiral Merritt looked at her for a long moment. When he spoke, his voice had changed. Something had cracked in it, very small, the way ice cracks at the edge before the whole surface shifts. "How sure are you?" Dana didn't look away. "Sure enough to be standing here." Harwell cleared his throat. "Admiral, I have to strongly caution you against—" "Dr. Harwell." The Admiral's eyes moved to him slowly. "I want another opinion." Harwell's expression cycled through several things quickly. "Of course, that's your right. But I want to be clear that in my professional assessment, this nurse has made an error, and I would not want—" "I disagree." The 3 words came from Dana, quiet and clean as a blade. Harwell looked at her. "I beg your pardon? You said I made an error. I disagree." She wasn't raising her voice. She wasn't performing anything. She was just standing in the fact of what she believed, the way you stand in ground you've chosen. "I've worked with patients in these classifications before, in field conditions and in clinical settings. What I observed in Kyle Merritt this morning was not an error. And I'm asking, formally, on the record, in front of this patient's father, that an independent evaluation be arranged." The hallway was so quiet You could hear the ventilator cycling from behind the door of room 712. Harwell looked at Patricia. Patricia's face gave him nothing. He looked at the Admiral. The Admiral was looking at Dana. "I want to see him," the Admiral said. "Of course, sir," Dana said, and stepped back from the nurse's station toward room 712. "I'll go in with you, if you'll allow it." The three of them, Dana, the Admiral, and Patricia, who had decided without quite deciding that she needed to be there, walked down the hall toward room 712. Harwell stood at the nurse's station. He did not follow. Inside the room, it was the same as always. The beeping, the ventilator. Kyle Merritt, young and still, in a bed that had begun to seem like it was slowly absorbing him. The Admiral stood at the foot of the bed for a moment. Then he moved to the side, closer, and his hand went to Kyle's arm. Not dramatically, just a father's hand, finding his son. Dana positioned herself on the opposite side of the bed. She leaned slightly forward. She waited for the Admiral to look at her, and when he did, she gave him a small nod. Be still, be quiet. And he understood because he had spent his life understanding that kind of signal. She spoke to Kyle. "Kyle, my name is Dana. I was here this morning. Do you remember?" A pause. "If you can hear me, I want you to do what you did before. Move your ring finger, left hand, just like before." The monitors beeped. The ventilator breathed. Admiral Merritt's grip on his son's arm tightened almost imperceptibly. The ring finger on Kyle Merritt's left hand curled inward. The Admiral made a sound. It was not a word. It was the sound that comes out of a person when something they have been refusing to believe just becomes undeniable, and the body has to go somewhere with all of that. It was brief. He swallowed it almost immediately, the way men like him swallow things. But in the half second that it was in the room, it was the most human sound Dana had heard in months. "That's him," she said softly. "That's Kyle." The Admiral looked up at her. His eyes were steady. His voice, when he found it, was very controlled. "What do we do now?" Dana straightened up. "We get someone in here who is going to look at this without having already decided what they're going to see. An independent neurological evaluation. Full workup. I want functional imaging if we can justify the transport." She paused. "And I want everything I've documented to go into the official record before anyone can argue that it was incidental." The Admiral nodded once, slowly. "Who do I talk to?" "Start with the Chief of Medicine. Go over Harwell's head if you have to." She looked at him squarely. "And Admiral, don't let anyone in this building tell you that you're being led by grief. You came in here every morning for 4 months because you knew. Trust that." His jaw worked. He looked down at his son, then back at her. "I've known 3 kinds of people in my career," he said. "People who talk about what they'll do, people who freeze when it matters, and people who just do the thing." He paused. "Which one are you?" Dana picked up Kyle's chart from the bed hook and started making additional notes. She didn't look up. "I'm the one who's already doing it," she said. Down the hall at the nurse's station, Dr. Harwell stood with his coffee, looking at the closed door of room 712. His face was unreadable. His hands were still, but in his chest, something was moving that he didn't want to name. Something that came from being a man who had been in medicine long enough to know that the worst thing that can happen to a diagnosis is not a patient dying. It's a patient living when you said they wouldn't. He set his coffee down. He picked up the phone. He called administration. The call Harwell made to administration lasted 4 minutes and 30 seconds. Dana knew this because Patricia told her. And Patricia knew it because she had been standing close enough to the nurse's station to hear Harwell's voice through the receiver. Not the words, but the tone, which was the tone of a man building a case. The efficient, clipped tone of someone who is not complaining, but is very carefully constructing a version of events that will be useful later. Patricia found Dana in the supply room at the end of the hall, restocking her cart, and she closed the door behind her. "He called Dr. Ellison," Patricia said. Dr. Ellison was the chief of the medical staff. Patricia didn't have to explain why that mattered. Dana already knew. He's framing it as a concern about a new nurse overstepping, making unsupported clinical observations, potentially destabilizing a family that had begun the process of accepting a terminal prognosis. Dana didn't stop what she was doing. She lined up the saline flushes with the same attention she gave everything. How long before Ellison calls me in? Maybe today, maybe tomorrow morning. Patricia paused. Dana, I need you to understand what you're walking into. Harwell has been at this hospital for 11 years. He's on the credentialing committee. He knows where every body is buried, metaphorically speaking. He does not like being contradicted, and he especially does not like being contradicted by someone who has been here for 48 hours. I know. Do you? Patricia's voice sharpened just slightly. Because what you did in that hallway, in front of the Admiral, in front of me, that kind of thing doesn't just blow over. He is going to come at your license. He is going to question your documentation. He is going to find every gray area in what you observed and fill it with doubt. She stopped. I'm not telling you to back down. I'm telling you to understand the cost. Dana finally looked up. In 2011, I was in a fire base in Kunar province. We had a soldier, Corporal Eddie Reyes, who took shrapnel from an IED and went down hard. The battalion surgeon called it, said he was gone, said continuing care was a waste of resources we didn't have. She held Patricia's gaze. I disagreed. I sat with that man for 11 hours. I used everything I knew, and some things I was still figuring out. And Eddie Reyes walked out of Landstuhl Hospital under his own power 14 weeks later. She paused. His mother sends me a Christmas card every year. She writes the same thing every time. She says, "Thank you for not believing the easy answer." Patricia was quiet for a moment. Kyle Merritt is not Eddie Reyes. No, Dana agreed, but he's also not gone. Patricia looked at her for a long moment. Then she straightened up, pulled the supply room door open, and said, over her shoulder, "Document everything, every interaction, every observation, every time, date, and response. Don't give them a single thing they can call sloppy." She walked out. Dana went back to her saline flushes. By 10 o'clock that morning, the Admiral had reached the Chief of Medicine's office. Dana didn't see this happen. She was on the floor, doing her rounds. But she heard about it from Trevor, the overnight nurse who had somehow not gone home yet and was sitting in the break room with a cold cup of coffee and an expression of someone who had accidentally wandered into a movie and wasn't sure if he was an extra or a main character. The Admiral walked straight past the receptionist, Trevor said, eyes wide. Didn't stop, didn't knock, just opened the door and went in. Ellison's assistant tried to stop him, and he just looked at her, and she just sat back down, like a reflex. Rear Admiral Thomas Merritt had spent 34 years commanding men and machines in situations that did not want to be commanded. He had walked into rooms that were designed to be intimidating. He had sat across tables from people who held things he needed and had learned to hold his position until they moved first. He was not going to be stopped by a receptionist outside a hospital administrator's office. Dr. Richard Ellison was 53 years old, had a medical degree from Johns Hopkins and an MBA from Wharton, which in hospital administration made him either unusually qualified or somewhat dangerous, depending on who you asked. He was sitting behind his desk reviewing a budget report when the Admiral came through his door, and to his credit, he did not visibly flinch. He simply set down his pen and said, "Admiral Merritt, I was going to call you this afternoon." "I saved you the time," the Admiral said. He sat down in the chair across the desk without being invited. "I want an independent neurological evaluation of my son. I want it arranged through this hospital with an outside specialist, someone with no prior connection to Kyle's case, and I want it done within 72 hours. Ellison folded his hands on his desk. "Admiral, I understand this is an incredibly difficult—" "I'm going to stop you there," the Admiral said, Because what I don't need right now is the version of this conversation where someone explains to me how difficult this is. I know how difficult this is. I have been living how difficult this is for 4 months. His voice was measured, controlled, but there was something underneath it that Ellison could hear, the way you can hear a river under ice in winter. This morning, a nurse on your ward observed what she documented as a volitional response from my son in direct correlation with verbal command. She documented it, I witnessed it, and then the attending physician called administration to protect his diagnosis before anyone could challenge it. I want to know what you're going to do about that. Ellison was quiet for a moment. You're referring to the new nurse's notation. Dana Collier. I'm referring to my son moving his finger when a medical professional asked him to. Yes. Dr. Harwell's assessment. Dr. Harwell was not in the room, the Admiral said. Miss Collier was. I was. And I am asking you, formally, and I want this conversation noted, for an independent evaluation. He paused. I am also asking you to make sure that no action is taken against Miss Collier's position or licensure while that evaluation is pending. Because if I find out that someone in this hospital moved against her for telling me the truth, the kind of phone call I will make will not be going to your office. It will be going to the Senate Veterans Affairs Committee, 3 of whose members I have personal relationships with. Are we clear? Ellison held his gaze. Then he uncapped his pen and wrote something on the notepad in front of him. I'll make some calls, he said. The Admiral stood up. 72 hours, he said again, and walked out. Back on Ward 7, Dana was standing at Kyle's bedside for the 3rd time that day, and this time she was not alone. She had asked Trevor, who had finally been convinced to go home, then had inexplicably come back 20 minutes later, to stand in the doorway. Not to help, just to witness. She needed someone to corroborate what she was doing and when she was doing it, because she already understood that the next move in this game was going to be the slow erosion of her credibility, and she was building her record 1 brick at a time. Kyle, she said, pulling the chair to his left side, I need to do something a little different today. I'm going to ask you some questions, and I want you to respond the way you did this morning, with your left hand. 1 movement for yes, 2 for no. Can you try that for me? She waited. The ventilator ran its cycle. The monitors held their rhythm. Then the ring finger curled once. Trevor, from the doorway, made a sound that was almost inaudible. Dana did not look at him. She kept her eyes on Kyle's hand. Good, she said quietly. That was very good. Now I'm going to ask you something easy first. Are you in pain right now? A pause. Then 2 curls. Fast. Definitive. Dana wrote it down. Okay. Are you aware that you're in a hospital? 1 curl. Do you know why? 1 curl. She leaned slightly forward. Kyle, this is important. I need you to stay with me. I know this is hard. I know you're tired. But I need you to answer 1 more. She paused. Do you know who I am? A long silence. 10 seconds. 15. The finger did not move. Then slowly, 2 curls. That's okay, she said. That's actually great. You're distinguishing between yes and no. You're processing the question. She straightened up, made more notes, dated and timed everything to the minute. Then she looked up at Trevor in the doorway. You saw that? Trevor nodded. He looked like a man who had walked into work expecting an ordinary shift and had instead watched something that was going to stay with him for a very long time. Yeah, he said, I saw it. Sign my notes as witness. He came in, picked up the pen she held out, and signed without another word. What happened next happened fast. Not the kind of fast that is dramatic and announced. The kind of fast that you only recognize later, when you're looking back and trying to figure out where the tide turned. At 11:42, Dr. Harwell arrived on Ward 7 and walked directly to the nurse's station. He pulled up Kyle's file on the terminal. He read Dana's new notations. His face did not change. He read Trevor's witness signature. His jaw tightened once. Then he picked up the phone and called the attending neurologist from week 2, a Dr. Patel who had signed off on the vegetative state diagnosis, and had a conversation that Dana couldn't hear, but Patricia could, from 2 desks over. And afterward, Patricia came to find Dana with an expression that had gone from guarded to hard. "He's getting Patel to reaffirm the diagnosis," Patricia said, "formally, in writing, today, before any independent evaluation can be arranged." Dana stopped typing. "He's trying to lock it in. He's trying to make it look like the existing diagnosis was reviewed and upheld before anyone can accuse him of not doing his due diligence." Patricia lowered her voice. "If Patel signs that document today, it creates a paper trail that any independent neurologist is going to have to directly contradict, not just supplement. It makes the evaluation harder to get traction." Dana stood up. "Where is Patel now?" "In the building. Harwell called him in for an urgent review." "Where in the building?" Patricia looked at her carefully. "Dana." "Patricia, where is he?" A beat. "Conference room B, 2nd floor." Dana was already walking. She took the stairs. She moved the way she moved when she had somewhere to be, and time was the variable she couldn't control. Conference room B was at the end of the 2nd floor administrative corridor, a glass-walled room that looked out onto the main hall. She could see through the glass before she reached the door. Harwell, standing. Dr. Patel, seated, reading something on a tablet. A woman Dana didn't recognize, who might have been an administrator or might have been from legal, seated at the corner of the table with a laptop. Dana knocked twice and opened the door. All 3 of them looked up. Harwell's expression went through surprise, fury, and control in about half a second. "This is a private consultation," he said. "I know," Dana said. "I won't be long." She looked at Dr. Patel. He was younger than she expected, mid-40s, tired-looking, with the face of a man who was not sure how he had ended up in this room. "Dr. Patel, I'm Dana Collier, Ward 7. I'm the nurse who made the notations in Kyle Merritt's file this morning." Patel glanced at Harwell, then back at her. "I've seen the notations. Then you've seen that since your last assessment, Kyle has demonstrated reproducible, directed motor responses correlated with verbal command. I've documented 3 sessions this morning. The most recent was witnessed and co-signed." She stepped slightly further into the room. "I'm asking you, before you sign anything today, to review that documentation in full, and I'm asking you to consider whether a formal review of this patient, conducted in person, by you or by an independent neurologist, is indicated before any existing diagnosis is reaffirmed." Harwell stepped forward. "Ms. Collier, you have absolutely no right to—" "I'm speaking to Dr. Patel," Dana said. She did not look at Harwell. She kept her eyes on the neurologist. "Dr. Patel, everything I've documented is in the system. It will take you 20 minutes to read. All I'm asking is that you take those 20 minutes before you sign." She paused. "If after that you still believe the current diagnosis is correct, I won't argue with you, but I think you should see it first." The room was very quiet. The woman with the laptop had stopped typing. Dr. Patel looked at his tablet, then at the table in front of him, then at Harwell. "She's right," he said quietly. "I should look at the full record." Harwell said, "Richard, the reason I called you in was—" "I know why you called me in," Patel said. His voice was mild, but there was something in it that hadn't been there 30 seconds before. "And I'd like to review the nursing notes from this morning before I do anything else." He looked at Dana. "Thank you, Miss Collier." Dana nodded once. She walked out. She was in the elevator when the shaking started. Not visible, contained, internal, the body releasing what it had been holding. She pressed her back against the elevator wall and breathed through it. 4 floors. She had walked into a room she had no official right to enter, interrupted a meeting that had been arranged specifically to go around her, and directly addressed a physician who was 2 credential levels above her. If this went wrong, It wouldn't just be her job, it would be her license, her ability to ever do this work again. She thought about Eddie Reyes. She thought about his mother's Christmas cards. She thought about the ring finger on Kyle Merritt's left hand, curling inward and releasing in the silence of room 712, while his father's grip tightened on his arm. The elevator doors opened. She stepped out. She went back to work. At 2:15 in the afternoon, Dr. Patel came to Ward 7. He came alone. He didn't go to the nurse's station first. He went directly to room 712, and he was there for 40 minutes. Dana knew this because she was monitoring from the hall, doing legitimate work nearby, and she watched the door the way you watch a door when what's behind it matters. When Patel came out, he stood in the hallway for a moment, just stood there. And then he looked down the corridor and found Dana with his eyes, and she could not read his expression except to say that it was different from the one he'd come in with. He walked to her. "I want to run a formal bedside assessment," he said low. "Standardized responsiveness scale, full protocol. Tomorrow morning, 8 o'clock. He paused. "I'm not signing anything today." Dana let out a breath. "Thank you." "Don't thank me yet." His voice was quiet and very serious. "If this goes where you think it goes, there are going to be people in this building who are very unhappy. And the weight of that is going to fall on you more than anyone else. Are you prepared for that?" "Yes," she said without hesitation. He nodded slowly. "I'll see you at 8. He left, and Dana stood in the hallway of Ward 7 with the clinical sounds of the ward around her. The steady beeping, the hush of forced air, the distant. What she knew was that one day was more than he'd had this morning. It was 3:40 when her phone buzzed in her pocket. An internal extension. She answered. "Miss Collier." The voice was Ellison's. Calm, professional, with a particular quality of neutrality that administrators develop like a second skin. "I'd like to." Ellison's office was quieter than the ward, which Admiral Merritt has formally requested an independent. When? "He can be here by Thursday. He has been valuable." About Eddie Reyes and the 4 minutes Kyle Merritt had spent without oxygen at the bottom of a training dive, and everything that hung on the space between what medicine said was possible and what she believed she had seen. "Not even close," she said. She walked back to Ward 7, and the first person she saw when she came through the door was the Admiral. He was sitting in the chair just outside room 712, not pacing, not on the phone, just sitting, upright, hands on his knees, the posture of a man maintaining his bearing in a situation that had already cost him more than most people ever have to pay. He looked up when he heard her footsteps. "Torrance is coming," she said. "Wednesday or Thursday." The Admiral was quiet for a beat. Then he said, "And Harwell?" "Still the attending of record, for now." She sat down in the other chair, the one against the wall. "He's not going to make this easy. He's going to fight the evaluation. He's going to call everything I documented into question. He may try to move against my position here before the week is out." The Admiral looked at her steadily. "But?" Dana clasped her hands in her lap. "But Kyle answered me this morning. 3 sessions. Reproducible. Witnessed and documented." She paused. "He knows he's in a hospital. He knows something happened to him. He's tired and he's working very hard to communicate through equipment and damage that would make most people give up. But he's not giving up." She looked at the door of room 712. "And neither am I." The Admiral followed her gaze to the door. For a long time, neither of them said anything. Then, very quietly, he said, "He was going to be the first Merritt in 3 generations to get out. He decided during his last tour. He was going to come home, go back to school, become a marine biologist. Crazy, right? SEAL turned marine biologist." His voice was even. He'd been accepted to Florida State. He was supposed to start in January. Dana didn't say anything. Sometimes the right thing is to let a thing be what it is. "He has to get there," the Admiral said. Not to her, not exactly. More like a statement being made to the universe, quietly and with great deliberateness. "He has to get there." Down the hall, behind a closed door in the administrative wing, Dr. Harwell picked up his cell phone, not the hospital line, and dialed a number he had not dialed in 2 years. The phone rang twice. A voice answered. Harwell turned slightly away from the window, lowered his voice and said, "I need to talk to you about someone. A nurse. She's been here 3 days and she's already burning down everything I built on that floor." A pause. "I need to know what her record looks like. Everything. Bethesda, Landstuhl, her deployments. I need to find the crack." His hand tightened on the phone. There's always a crack. The crack Harwell was looking for took him less than 18 hours to find. That was the thing about a person's past. If someone was motivated enough and connected enough, it didn't stay buried long. And Harwell was both. Dana found out at 6:50 the next morning. She was in the break room, coffee in hand, reviewing her notes from the previous day's sessions with Kyle, when Patricia walked in and closed the door with the deliberate quietness of someone delivering news they don't want to deliver. Dana looked up. One look at Patricia's face and she set the coffee down. "What happened?" she said, not a question. "Harwell submitted a formal complaint to the nursing board last night," Patricia said. "He flagged an incident from your time at Landstuhl 3 years ago. A patient, a soldier, where you apparently deviated from the attending physician's orders." She paused. "He's calling it a pattern, unsanctioned clinical intervention. He's using it to argue that your observations on Kyle's case can't be trusted because you have a history of," his words, quote, "substituting personal judgment for established medical protocol," end quote. Dana sat very still. The break room hum of the refrigerator filled the silence. "The incident at Landstuhl," she said. "That was Eddie Reyes. He doesn't name the patient. He doesn't have to. He just needs the documentation of the deviation. The deviation that saved the man's life." "Dana," Patricia sat down across from her. "I know, but right now on paper, before anyone looks at the outcome, it looks like a nurse who doesn't follow the rules. And that's the story he's telling. He's going to walk into Ellison's office this morning with that complaint and argue that everything you've documented about Kyle should be treated with skepticism because you have a prior pattern of overreach." She pressed her hands flat on the table. "He's trying to get your documentation thrown out before Torrance even arrives." Dana looked at her coffee. She looked at her notes. Then she looked at Patricia. "How long before Ellison has to act on the complaint?" "Formally, he has 72 hours. But Harwell doesn't need 72 hours. He just needs this morning." Dana stood up. "Then I need this morning too." She left the break room. She went to Ward 7. She went directly to room 712. She did not stop at the nurse's station. She did not check messages. She had 40 minutes before the shift fully turned over, and the day started moving at institutional speed, and she was going to use every one of them. Kyle was the same as she'd left him the night before. Monitors steady, ventilator cycling. The room had the particular stillness of early morning in a hospital before the day crew arrived and the hallways got their noise back. Dana sat in the chair, pulled it close, and leaned forward with her elbows on her knees. "I need to talk to you," she said quietly. "Not as your nurse right now, just person to person." She paused. "Things are getting complicated on my end. I need you to give me something they can't explain away. Something that isn't a reflex, isn't a twitch, isn't anything that a physician with a motivated argument can call spontaneous motor activity." She was quiet for a moment. "I know you're tired. I know what I'm asking is hard. But Kyle, your dad is sitting outside that door every single morning. He's been doing it for 4 months. And he needs to know. You need to let him know." She reached into the pocket of her scrub top and took out a small pen light. Not for his eyes. She wasn't going to touch his eyes without authorization. She held it in her hand and she said, "I'm going to try something." "Kyle, that is so good." She made the note immediately, time-stamped it, and then kept going. "Now, both hands. Move both index fingers at the same time. She was writing so fast her handwriting was barely legible. And she didn't care, because Trevor was in the doorway again. She texted him before if the second word is correct, right hand. She paused, steadied her voice. Kyle, first word, sleeping. Second word, listening. Which one are you doing right now? 15 seconds. The right hand moved. Trevor said from the doorway, "Oh my God." "Trevor," Dana said without turning around, "write that down." It was 7:38 when Dr. Patel arrived on Ward 7. He came with a clipboard and the standardized responsiveness assessment tool, the Coma recovery scale, revised version, which was the gold standard. Dana met him in the hall and walked him through everything. "The principle is, I need to see it myself," he said. "I know," Dana said. "That's why I documented everything I did this morning before you arrived, so you could see what baseline I'm working from." They went in together. The Admiral was already in the hallway. He'd arrived at 7:15, same as every morning, and Dana looked at him as they passed and said, "Come in. You should be here for this." The three of them stood around Kyle's bed, and Patel ran his assessment. He started with the standard items: auditory, visual, motor, verbal subscales, going methodically through the protocol the way he'd done it 100 times. And the difference, today, from every other time this scale had been administered to Kyle Merritt over 4 months, was that today the patient was responding. Not to everything, not dramatically, not in ways that an untrained observer would have immediately recognized as consciousness, but to a neurologist who knew what to look for: the latency of the responses, the inhibition on non-target items, the specificity of the motor output relative to the command. The picture being assembled on that clipboard was not the picture of an absent person. Patel asked Kyle to move his left thumb in response to his name. Kyle moved his left thumb. Patel asked him to do nothing in response to a false name, Joseph, and Kyle did nothing. He asked him to look toward the sound of his voice, and Kyle's eyes, which had been still, tracked approximately 2 degrees to the left. Slow, effortful, but directional. The Admiral made no sound. He was standing very straight, very still, watching his son's face with the controlled ferocity of a man who has learned to take inventory of miracles very quietly because he is afraid that making noise will stop them. When Patel finished, he stood at the foot of the bed and looked at his clipboard for a long time. Then he looked at Dana, then at the Admiral. Then he said simply, "I'm not signing Harwell's document." The Admiral's breath came out in a long, slow, controlled release. "What does that mean?" he said. "It means the existing diagnosis needs to be formally reconsidered. Kyle's scores on this assessment today are inconsistent with vegetative state." Patel's voice was careful and precise. "I want to be very clear. This is not a diagnosis of consciousness. It is a documented shift in assessed responsiveness that requires follow-up investigation. But it is enough to halt any conversation about withdrawal of care until a full independent review has been completed." "And Torrance?" Dana said. "More important than ever," Patel said. "What you've built here," he looked at Dana's notes, "is a case. It's not complete, it's not definitive, but it's a case." He paused. "Harwell is not going to accept this quietly." "I know," Dana said. He handed her the clipboard. "Make copies of everything before end of business today." He walked out. It was 8:17 in the morning, and Harwell had been in Ellison's office for 12 minutes. Dana knew this because Patricia had a source in administration, a scheduling assistant named Gwen, who had worked at that hospital for 19 years and had opinions about most of what happened in it. And Gwen had texted Patricia at 8:05. Harwell just walked in. Not an appointment, just walked in. Same as the Admiral yesterday. Door closed. Patricia relayed this to Dana at the nurse's station, and Dana nodded once and kept writing in the chart. There was a particular kind of clarity that came to her in moments of maximum pressure. Not calm exactly, but precision. Everything went quiet inside, and what remained was just the next right action. She had learned this in Afghanistan, where the cost of losing that clarity was measured in ways she didn't let herself think about too specifically. She finished the chart, dated and timed her final entry, printed a hard copy, and put it in her own bag. Then she made a second copy and put it in the patient record file that lived outside the room. Then she emailed the entire documented record of sessions, time-stamped and annotated, to her own personal email address with a subject line that read, Kyle Merritt, session log, do not delete. She was not going to let Harwell bury this in a server. At 9:04, Ellison called her. She was ready for the call. She answered on the second ring. Ms. Collier, he said, Doctor, Harwell has presented documentation of a prior incident at Landstuhl Regional Medical Center involving deviation from physician orders. He's asked me to consider placing you on administrative leave pending review of your credentials and the validity of your observations on the Merritt case. Dana said, And what did Dr. Patel's assessment this morning show? A pause. He submitted a revised clinical observation. I've read it. Then you know that Kyle Merritt scored above the threshold for vegetative state on 3 subscales of the CRSR this morning, in a formal, standardized, physician-administered assessment. She kept her voice even. Whatever happened at Landstuhl, and I'll answer every question about it completely with full documentation, it does not change what those scores say. Dr. Patel saw it. I saw it. The Admiral saw it. A pause. If you place me on leave before Torrance arrives, you remove the only person on this ward who has been actively building the observational baseline that Torrance needs to do his job properly. You would be doing Harwell's work for him. Ellison was quiet for a long moment. The Landstuhl incident, he said finally. The patient. Corporal Eddie Reyes. He is alive. He is a graduate student at the University of Southern California. He will answer the phone if you call him. She paused. I deviated from the attending's orders because the attending had called a survivable patient non-survivable. I documented my reasoning at every step. I flagged my deviation through the chain of command. I did not hide what I was doing. Her voice was steady. The outcome speaks for itself. Another silence, longer this time. I'm not placing you on leave, Ellison said. Not before Torrance's review. But I need you to understand that this situation is being watched very carefully at the administrative level. And I need everything you do from this point forward to be by the book. Completely documented. No improvisation that isn't supported by literature and recorded in the chart before you do it. Are we clear? Completely, she said. She hung up. She pressed the phone against her chest for 1 second. Then she went back to work. What Dana did not know, could not have known, was that at 9:21 that morning, while she was on the floor making rounds, a man named Dennis Carver walked into the lobby of James A. Haley Veterans Hospital and asked the front desk to direct him to the neurology department. Carver was 58 years old, wore a gray sport coat that had seen better days, and carried a reporter's notebook that he kept in his left breast pocket the way people carry things they think with. He was a senior health reporter for the Tampa Bay Tribune, and he had received 20 minutes earlier an anonymous email with the subject line, "Via hospital covers up signs of life in SEAL's son." The email contained no names other than Kyle Merritt's, no specific clinical details, just enough: a vegetative patient, a new nurse, a doctor trying to shut it down, an Admiral, a neurologist coming from out of town. Just enough to make Carver pick up his jacket and drive. Dana didn't learn about Carver until 2:30 that afternoon, when Trevor, who had become in 3 days the most reliably present person in Dana's orbit on this ward, appeared at her elbow with wide eyes and said, "There's a reporter in the building." Dana looked at him. "How do you know that?" "Gwen texted Patricia. Patricia texted me." He held out his phone. Dana read the text. Her jaw tightened slightly. "Harwell," she said. "You think he called a reporter?" "I think someone did." She thought about it for 3 seconds. The anonymous email. The timing, right after Ellison had refused to put her on leave. Harwell couldn't use the hospital administration to remove her, so the next move was public pressure. Get the story out with a particular angle: rogue nurse, disrupted family, institutional chaos, before Torrance arrived and could potentially validate everything she'd done. If the press ran a story that made Dana look like a grief-exploiting outsider who had given a desperate father false hope, it would be almost impossible to walk that back. The Admiral would be in a defensive position. The hospital would want to distance itself, and by the time the independent evaluation happened, the narrative would already be set. She said, "I need to find the Admiral. Right now." She found him where she always found him, outside room 712, sitting in the chair with his hands on his knees. She crouched down so she was at eye level with him, because she needed his full attention, and she needed him to understand that she was not panicking. "There's a reporter in the building," she said quietly. "Someone sent an anonymous tip to the Tribune. It may have been Harwell. The angle of the tip is designed to make this look unstable. A nurse going rogue, giving you false hope. If the reporter gets a story before Thursday, it could complicate everything." She paused. "Do not talk to him. Not today, not until after Torrance has done his evaluation, and we have a formal, documented neurological finding to stand on. If you talk to a reporter right now, anything you say gets filtered through a story we didn't write." The Admiral looked at her steadily. "You think Harwell is that strategic?" "I think he's been playing institutional politics for 11 years, and he's very good at it." She held his gaze. "I think he realized this morning that he couldn't get me removed through administration, and he moved to the next option. He's trying to control the story before the story controls him." The Admiral was quiet for a moment. Then he said, "Can I ask you something?" "Yes." "Have you slept in the last 48 hours? It caught her slightly off guard. "Some," she said. "How much is some?" She thought about it. 4 hours, maybe. He looked at her with an expression that was not quite paternal and not quite strategic, and was somehow both. "You can't fight this on no sleep. Whatever you learned in Afghanistan about running on empty, this is a different kind of war. You need to be sharp on Thursday when Torrance arrives. You need to be the most credible person in that room." She looked at him for a moment. Then she said, "I'll sleep tonight." "Good." He stood up, straightened his shirt. "And I'll handle the reporter." "Admiral," I said, "I heard what you said." His voice was calm and very final. "I'm not going to give him a story. I'm going to give him a wall." He looked down the hallway. "I've been dealing with press since before that man was in journalism school. I know how to make a conversation happen that results in absolutely nothing being printed." He paused. "You focus on Kyle. Let me focus on this." Dana looked at him. He was 70 years old, maybe, and he looked in that moment like someone who had decided very clearly which hill he was standing on. She nodded. "Okay." He walked toward the elevator. She went back to room 712. She sat with Kyle for 20 minutes alone, not running a session, not taking notes, just sitting. She talked to him about Eddie Reyes. She told him the whole story, beginning to end. The fire base, the battalion surgeon, the 11 hours, Landstuhl, the Christmas cards. She told it the way you tell a story to someone you need to understand something. "He didn't give up either," she said. "Even when he couldn't show anyone that he was still in there, he just kept holding on." She looked at Kyle's hand. "You're doing that. I need you to keep doing that until Thursday. Can you do that for me?" The ring finger on his left hand curled once. Held. Released. She put her hand over his, very briefly, just a second. Then she took it away and sat up straight, because she was a nurse in a hospital, and there were rules she wasn't going to break, not even now. "Thursday," she said. 2 more days. At 4 o'clock, Patricia came to find her with an expression Dana hadn't seen on her yet. Not guarded, not careful, but genuinely unsettled. "Harwell pulled Kyle's chart," Patricia said. Dana looked up. What? 20 minutes ago, he pulled the full chart into his access session and spent 17 minutes with it. Patricia's voice was tight. He has attending authority. He can do it. But the timing. He's looking for something to challenge, Dana said. She was already thinking. He's going to find a way to reframe the documentation. Mark something as anomalous. Create a counter-narrative in the chart itself before Torrance reads it. She stood up. I need to check what he changed. He can't change documented entries. They're time-locked in the system. He can add his own notes. He can annotate. He can write an attending's addendum that frames everything I wrote in his language, not mine. She moved to the terminal. He can make sure the first thing a reader sees is his interpretation. So by the time they get to my notes, they've already been told what to think. She pulled up Kyle's chart. Harwell had added an attending note at 3:52. She read it. It was 2 paragraphs long, written in the careful, measured language of someone who knows the difference between what sounds objective and what is objective. It didn't dispute her observations directly. It contextualized them. It described her documented sessions as potentially reflecting, quote, observer influence on minimally evoked motor phenomena, end quote. It suggested that the responses she'd elicited might be the product of what he called, quote, heightened expectation bias in an observer with a prior history of non-protocol clinical intervention, end quote. And it recommended that Torrance's evaluation be conducted blind to Dana's session logs to avoid, quote, confirmation contamination, end quote. It was, Dana recognized with a cold clarity, very well done. He wasn't attacking her documentation. He was poisoning the well around it. If Torrance came in and read that note first, and then read Dana's logs, he would be reading them through a lens that had already been constructed for him. Harwell was suggesting that Dana had essentially coached the responses, not through deception, but through unconscious expectation. That what she documented was a nurse who wanted so badly to see something that she had created the conditions that made her see it. Dana stared at the screen. Her hand on the mouse was very still. He's good, she said finally. He's been doing this a long time, Patricia said. Dana pulled up a new entry window. She began to type an addendum of her own, factual, time-referenced, co-signed by Trevor, citing the specific literature on covert awareness and the Cambridge protocols. She wrote for 15 minutes and she wrote carefully, because she understood that what she was doing was not just making notes. She was building a record that was going to outlast this week, this hospital, this moment. She was writing for Torrance and for any neurologist or ethics committee that would ever look at this chart. She wrote it for Kyle. When she finished, she printed it, had Trevor sign, and added it to the chart at 5:18. Then she sat back in her chair and rubbed her eyes. Her phone buzzed. Unknown number. She almost didn't answer. Then she did. The voice on the other end was male, young, slightly uncertain. Is this Dana Collier, the nurse at Haley? She said nothing for 2 seconds. Who is this? My name is Daniel Reyes, the voice said. Eddie's younger brother. Eddie asked me to call you. He said you need to know something. A pause. Harwell's people contacted Eddie today. They asked him questions about you, about Landstuhl, about what happened. Another pause. Eddie wanted you to know that he didn't tell them anything except the truth. And the truth is, the voice steadied, you saved his life. He said to tell you, hold the line. Whatever they're doing to you over there, just hold the line. Dana sat in the chair at the nurse's station at 5:23 in the afternoon, with the sounds of Ward 7 around her, and she pressed the phone against her ear and breathed. Tell Eddie, she said, her voice steady, that I heard him. She hung up. She stood up. She went back to work. Thursday was coming, and she was going to be ready. Dana slept 4 hours and 40 minutes that night. She knew the exact number because she watched the clock at 11:18 when she finally closed her eyes, and she was awake again at 4:02 without an alarm, the way she had always been awake before something important. Not anxious, just ready. The body knowing before the mind does that today is different from yesterday. She was on Ward 7 by 5:15. Thursday had arrived. The floor was quiet at that hour. The particular, suspended quiet of a hospital in the hours before the day shift, when the overnight nurses are running on their last reserves and the building itself seems to be holding its breath. Dana did her checks, updated her notes, and at 5:55 she went to room 712 and sat with Kyle for 30 minutes. She didn't run a formal session. She just talked to him. She told him what was going to happen today, in plain language, the way she told all her patients what was going to happen, because she believed, regardless of what any chart said, that people deserved to know. A neurologist named Marcus Torrance is coming today, she said. He's one of the best in the country at exactly this kind of assessment. He's going to spend time with you. He's going to be thorough, and what I need from you is exactly what you've been giving me all week. Just be present. Just respond when you can. Don't force it. Don't exhaust yourself trying. Just be there. She paused. Can you do that? Left hand, ring finger, one curl. Good, she said. That's all I needed. She stood up, smoothed her scrubs, and walked out of the room into a hallway that was about to become a very different place than it had been when she walked in. At 7:45, Dr. Marcus Torrance arrived. Dana had looked him up, of course. 3 days ago, the moment Ellison had mentioned his name. She had read 4 of his papers. She had watched 2 recorded lectures from a Johns Hopkins neurology conference. She knew his methodology, his published positions on covert awareness, his approach to disorders of consciousness assessment. She knew that he was rigorous, that he was skeptical in the best sense of the word, not dismissive, but demanding of evidence. She knew he had publicly disagreed with several high-profile vegetative state diagnoses and had been right each time. And she knew that if anyone could walk into room 712 and see clearly, without Harwell's framing, without the weight of 4 months of institutional consensus, it was him. He was taller than she expected, late 50s with the kind of deliberate physical presence that came from spending decades being the person in the room who had to deliver truths that nobody wanted to hear. He carried a single bag. He came with no residence, no assistants, just himself. Patricia met him at the elevator and brought him to the nurse's station. And Ellison was already there, as was Patel, and, Dana noted with a tension she kept entirely off her face, Harwell, standing at the far end of the station with his arms folded and an expression of professional courtesy that didn't reach his eyes. Torrance shook hands with Ellison, with Patel, with Harwell. He shook hands with Dana last, and when he did, he held her hand for 1 extra second and looked at her directly. "You're the one who built the observation log," he said. "Yes," she said. "I read it last night, all of it." He let go of her hand. "I have questions, but they'll wait until after I see the patient." He looked at Ellison. "I'd like to start immediately if that's possible, and I'd like to start alone, just myself and the patient. No observers in the room for the first session." He paused. "I want my baseline completely uninfluenced. I'll bring people in after." Harwell's jaw moved. "Dr. Torrance, I think it would be appropriate for the attending to be present." "I'll call for you when I'm ready," Torrance said pleasantly. It was the kind of pleasantness that closed a door. He picked up his bag and looked at Dana. "Room 712? Down the hall, second to last on the right." He nodded once and walked in that direction. The nurse's station was very quiet for a moment after he turned the corner. Harwell looked at Ellison. "I want it noted that I have concerns about the independence of this evaluation, given that the primary advocate for the patient has had direct contact with the evaluator prior to—" "Noted," Ellison said. His voice was flat and final. He picked up a folder and walked to his temporary office down the hall. Dana went to check on her other patients. She moved through their rooms with the focused attention she always gave them. But part of her, the part she'd been training all week to stay controlled, was tracking the minutes. Torrance had gone in at 7:52. She knew his standard initial assessment took between 45 minutes and an hour. She knew he would start with observation, then move to the formal CRSR protocol, then add his own supplementary tasks if the initial results warranted it. At 8:41, almost exactly 49 minutes after Torrance had entered room 712, his voice came over the nurse's station intercom. Short, direct. "I'd like Miss Collier in here, please." Dana was halfway down the hall before the sentence was finished. She pushed the door open. Torrance was standing at the left side of Kyle's bed with his assessment clipboard in one hand and a pen light in the other. He looked at her when she came in, and his expression was carefully, professionally controlled. But there was something in his eyes that she recognized, because she had felt it herself on day one. The particular electric quality of a person who has just seen something they were told they would not see. "Walk me through the word discrimination task," he said. "Exactly as you did it. Your language, your approach. I want to see your methodology." She moved to the right side of the bed. She took a breath. And she did it exactly as she had done it 3 days ago. The same language, the same pace, the same 2 words. Sleeping. Listening. Torrance watched. His clipboard was at his side. He was not writing, he was just watching. Kyle's right hand moved. Torrance looked at the hand for 3 full seconds. Then he looked at Dana. "Do it again," he said. "Switch the words." She switched them. First word, listening. Second word, sleeping. Longer pause this time. 20 seconds. 14. Dana kept breathing. And then, Kyle's left hand. Index finger. One deliberate curl toward listening. Torrance set his clipboard on the bed rail and pressed both hands flat against the rail and looked at Kyle's face. He stood like that for a long moment. Then he said very quietly, so quietly that Dana almost didn't catch it, "There you are." Her throat tightened. She held it. Torrance straightened up and picked up his clipboard. "I want the full team in here in 20 minutes, he said. "Patel, Ellison, and yes, Harwell. Everyone. And I want the family present." He looked at Dana. "Get the Admiral." She found the Admiral in his chair in the hallway. He was on his phone, standing as she approached, and she could see from 10 feet away that he had already registered the quality of her walk, the pace of it, the directness, and he was already ending his call before she reached him. "He wants you inside," she said. The Admiral looked at her for 1 second. "Is it good?" Dana met his eyes. "Go in," she said. "See for yourself." He went. She went to find Patel, then sent a message to Patricia to get Ellison. She did not personally go to get Harwell. She sent Trevor because she trusted Trevor and because she wanted her own hands free. The room at 912 was more crowded than room 712 had been in 4 months. Torrance stood at the head of the bed. Patel was to his left. Ellison was near the door. Harwell stood at the foot of the bed with his arms crossed and his face wearing the expression of professional engagement that cost him something to maintain. The Admiral stood at Kyle's right side, close, with his hand on the bed rail near his son's arm. And Dana stood where she always stood, at Kyle's left, close enough to see his hand. Torrance addressed the room. "I've completed my initial assessment. I administered the full CRSR protocol, plus 3 supplementary tasks from the Cambridge Covert Awareness Battery. Kyle Merritt's results today are inconsistent with a diagnosis of vegetative state. He said it clearly, without drama, the way you say something true. On the auditory subscale, he demonstrated command following on 4 out of 6 items. On the motor subscale, he showed volitional movement distinguished from reflex by latency, specificity, and bilateral discrimination. Most significantly, he demonstrated what I would classify as language-based cognitive processing, the ability to hear 2 semantically distinct words, assign them categorical meaning, and select the correct motor output." He paused. "This is not reflex activity. This is not spontaneous motor phenomenon. This is covert awareness. Kyle Merritt is conscious. The word landed in the room like something physical. The Admiral's hand closed on the bed rail. His head went down for a moment, just a moment, and then came back up, and his eyes were bright, and his jaw was set, and he was the most contained version of a man breaking open that Dana had ever seen. Patel exhaled. It was barely audible, but Dana heard it. Harwell said, "I'd like to see the assessment scores." Torrance looked at him. "Of course." He handed over the clipboard. Harwell read. His face changed in very small increments, not dramatically, not the collapse of a man admitting he was wrong, more the subtle, almost imperceptible shift of someone whose internal architecture is being stressed. He read for a long time. He handed the clipboard back. "A single assessment," he said, "conducted by an outside evaluator who had prior access to an advocate's documentation is not a clinical rediagnosis." Torrance looked at him calmly. "You're correct, which is why I'll be recommending a formal case review before the neurology board, a repeat assessment in 72 hours, and immediate initiation of a functional MRI referral to establish the neurological basis for the responsiveness I've documented today." His voice did not rise, did not harden. He spoke as if he was describing something obvious. "I'm also recommending that the existing diagnosis of vegetative state be formally suspended pending review, and I'm recommending that any conversations about withdrawal of care be halted immediately, effectively as of this moment." Harwell looked at Ellison. Ellison was reading something on his phone. He did not look up. "Richard," Harwell said. Ellison looked up. "I heard," he said. His voice was careful and quiet. "We'll follow Dr. Torrance's recommendations." He looked at Torrance. "Whatever you need." There was a silence in the room. Harwell looked at the floor for 1 second, which was 1 second more than he usually allowed himself. And then he looked at Kyle's face. And something happened there. Something private and complicated that lasted less than 2 seconds. And then he looked at no one in particular and said, "I'll need to review the formal documentation," and walked out. Nobody stopped him. Torrance turned to the Admiral. "Sir, I want to be honest with you about where we are, because you deserve honesty more than you deserve comfort right now." The Admiral met his eyes. "Your son is in there. He is aware. He is communicating in the only ways currently available to him. What we don't know yet is the extent of the damage and the ceiling of his potential recovery. That requires imaging, more time, more assessment. The road ahead is not going to be simple, and I won't tell you it is." He paused. "But Kyle is fighting, and he deserves a team that is fighting with him." The Admiral looked at Torrance for a long moment. Then he looked at Dana. And what passed between them was not words. There weren't words for what had happened in this room over the past 5 days. Not words that fit neatly into the space between a father and the nurse who had refused to let his son disappear. It was something older than words. Recognition, gratitude at a frequency that is almost indistinguishable from grief. "Thank you," he said. To Torrance, yes, but his eyes stayed on Dana when he said it. Dana nodded once. She looked at Kyle's hand. The ring finger curled just slightly and released, like a breath, like a hello. The administrative machinery that followed moved faster than Dana expected, which told her something about how thoroughly Ellison had reassessed his position. By 11 o'clock, a formal notation had been entered in Kyle's chart, suspending the vegetative state diagnosis pending review. By 11:40, the nursing board complaint that Harwell had filed against Dana had been flagged for counter-review in light of the day's documented clinical findings. Patricia delivered this news to Dana at the nurse's station with the expression of someone who has held tension in their shoulders for a week and has just been permitted to release it. "Flagged doesn't mean dismissed," Patricia said carefully. "I know," Dana said, "but it means it's not moving forward while the case is under active review." She looked at her hands on the keyboard, "which is enough." At 12:22, Harwell came back. Dana was alone at the nurse's station when he appeared at the end of the hallway. He walked slowly, which was unusual for him. Harwell almost always moved with the purposeful speed of a man with more important places to be. Today, he moved like someone who had made a decision that cost him something and was carrying the cost. He came to the station and stopped. He didn't look at the computer. He looked at Dana. She looked back at him. She didn't fill the silence. In 2019, he said finally, I had a case. Young woman, 32, riding accident, severe TBI. I assessed her for 3 weeks and I was confident. He paused. She came back. 14 months later, walked into this hospital on her own to thank the staff. He stopped again. The pause this time was longer. I never fully understood how I missed it. He looked at the floor for a moment, then back at her. I don't expect you to accept that as an apology. I'm not sure it is one. I'm just telling you. Dana looked at him. This man had tried to take her license, had called a reporter, had poisoned the well of her documentation, and stood in front of a family and told them to let their son go. She held all of that, and she let it sit there, and she said, Kyle still needs an attending physician who is going to advocate for his recovery. Someone who knows this case from the beginning, who knows this hospital and how to navigate the system for him. She held his gaze. Are you capable of doing that? He looked at her for a long time. Something shifted in his face, not softened exactly, more like settled. Yes, he said, I am. Then do it, she said, and she went back to her notes. It was Patricia who told Dana about the second twist at 2:15 in the afternoon, and it hit like cold water. The functional MRI referral, the imaging that Torrance had recommended as the next critical step in establishing the neurological basis for Kyle's responsiveness, had been submitted to the hospital's imaging department at 11:30. Standard processing time for an urgent referral was 4 to 6 hours. At 2:10, Patricia had checked the status of the referral. It had been reclassified, not denied, reclassified as non-urgent, which moved it from a Thursday afternoon slot to the following week's scheduling queue. Somebody in the imaging department had downgraded it. Somebody who had received a call before noon from a physician whose name was on the original referral history of the case. Dana read the chain of events that Patricia laid out and she said, Harwell, the reclassification request was submitted under his attending authority, Patricia said. He can do it. He's still attending of record. Dana stood up. Torrance is still in the building? Conference room A. He was meeting with Ellison. She was moving before Patricia finished the sentence. She knocked twice on the door of conference room A and opened it. Torrance and Ellison both looked up. She said, the MRI referral has been downgraded to non-urgent. It was reclassified under Harwell's attending authority. It's been pushed to next week. Torrance went very still for a second. Then he looked at Ellison. Ellison's expression shifted in a way that was almost imperceptible, but Dana caught it. The particular shift of an administrator who has just realized that he took his eye off a specific variable and is now calculating the cost. He picked up his phone. He dialed. He said into the phone, This is Dr. Ellison. I need the imaging department supervisor. Now. He paused. I'll hold. He looked at Torrance. I'll get it reinstated. By end of business today, Torrance said. It was not a request. By end of business today, Ellison confirmed. Dana walked back out. In the hallway, she stopped and stood still for a moment. She was not shaking. She was past shaking. She was in that place she recognized from Afghanistan, the place where you've been running so long on will alone that the body has stopped asking permission and is just executing. She pressed one hand against the wall, not for support, just for contact with something solid, and breathed in 3 counts and out 3 counts. Then she heard it. It came from room 712. It was not an alarm. The monitors would have triggered a different response from the nurse's station. It was something else. a sound she almost didn't trust because she wasn't sure she'd heard it correctly. She walked to the room. She pushed the door open. The Admiral was sitting in the chair beside the bed. His head was bowed. His hand was over his son's hand on the bed. And from somewhere, from Kyle, from the mechanical mixture of a man and his machines, from whatever space exists between being present and being lost, there was a sound. Low, labored, imprecise, but shaped. Definition, unmistakably shaped by intention. It was not a word, not yet. It was the shape a word makes before the voice learns how to hold it. The shape of the effort to say something. Dana stood in the doorway, and she gripped the doorframe with one hand, and she did not move. The Admiral looked up. His eyes were wet, fully, completely, without any management left in them. "He's trying to say something," he said. His voice broke on the last word. Just at the end, just the edge of it. "He's trying to talk." Dana crossed the room. She sat on the edge of the bed beside Kyle's left arm, and she leaned close and she said, steadily, "Kyle, we hear you. We're right here. Take your time." The sound came again, slightly more formed. Dana listened with her whole body, the way she had listened in the field, the way you listen when sound is the only information you have, and getting it wrong has consequences. It had 2 syllables. Something with a soft consonant at the front. She closed her eyes for 1 second and opened them. "Da," she said quietly. "Are you saying Dad?" Left hand, index finger, one fast, strong curl. The strongest response she had seen all week. The Admiral made a sound that had no word in any language. His head went forward. His shoulders, which had been straight for 4 months, curved inward, just for a moment, the way a person's shoulders go when they are finally allowed to stop holding everything up by themselves. Dana put her hand on his shoulder for a second. Just 1 second. Then she stood up straight and went to the nurse's station, and she called Torrance. He picked up on the first ring. She said, "He's vocalizing. 2 syllables, intentional, directed at his father." A pause. "He knows him. He knows who's in the room." Torrance was silent for 2 full seconds. Then he said, "I'll be right there." At 3:55 in the afternoon, with Torrance present, with the time and the interaction fully documented in Kyle's chart, with the Admiral's hand over his son's hand, and Dana on the other side of the bed, and the monitors recording everything they could record, Kyle Merritt produced 3 separate vocalizations. None of them were clear words. All of them were clearly intentional. All of them were directed in ways that Torrance documented with methodical precision toward the sound of his father's voice. Torrance wrote in the chart at 4:07, "Patient demonstrates volitional vocalization with apparent directional intent toward family member's voice. Responsiveness profile consistent with minimally conscious state above upper threshold. Reclassification of diagnosis warranted. Immediate multidisciplinary care team conference recommended." It was the official end of the vegetative state diagnosis. On paper, in ink, in the permanent record. And it was only the beginning of everything else. Dana left the room at 4:20 to give the Admiral time alone with his son. She walked to the end of the hallway, the part that dead-ended near the supply room, and she stood there with her back against the wall and looked at the ceiling. Her hands were loose at her sides. She breathed. In the background, the floor continued its steady rhythm. The beeps, the ventilator sounds, the distant clatter of the dinner cart beginning its run at the far end of the ward. She had been in this building for 6 days. 6 days from the morning she walked in with her single bag, and Patricia asked if she knew what floor she was requesting, to the afternoon that Kyle Merritt tried to say his father's name. She had not done it perfectly. She had made calls that could have ended her career. She had walked into rooms she had no right to enter and said things that no amount of nursing experience technically authorized her to say. She had operated, as Harwell had correctly identified, at the edge of protocol, not beyond it, but close enough that the edge was always visible. And she had done it because she had learned, in the hardest possible way, in the hardest possible place, that the edge of protocol is sometimes the only place where the truth can be found. Her phone buzzed. A text from an unknown number. She opened it. There were 4 words, just 4, but they reordered everything she thought she knew about the next chapter of this story. The text read, "We need to talk." And below it, a name she recognized immediately, not because she had met this person, but because she had read about them in the course of looking into Kyle's case, deep in a background document she hadn't been sure was relevant at the time. The name was Commander Sheila Voss, Naval Special Warfare Command, Kyle Merritt's commanding officer. Dana stared at the phone. The hallway was quiet around her. The ward continued its rhythm. In room 712, a father sat with his conscious son, 4 months after everyone had told him to let go. Dana typed back 2 words, "I'm here." She put the phone in her pocket. She pushed off the wall. She walked back toward the nurse's station because there was still work to do, and there was always more to the story than the part you could see from where you were standing. She had learned that too, in the places she didn't talk about. The mission didn't end when you thought it ended. It ended when it ended. And this one was nowhere near done. Commander Sheila Voss arrived at James A. Haley Veterans Hospital at 7:18 the following morning. And she arrived the way military officers arrive when they have decided that what they are walking into is an operational matter. Which is to say, she arrived with purpose and without announcement. She was 44 years old, compact, with close-cropped dark hair, and the particular economy of movement that comes from spending years in environments where unnecessary motion is a liability. She wore civilian clothes, but carried herself in the way that made civilian clothes irrelevant. Dana spotted her the moment she stepped off the elevator, before Voss had said a single word to anyone, because she recognized the bearing, the same bearing she saw every morning in the Admiral, the same bearing she had learned to read in Afghanistan, the bearing of a person who operates in the world as though the world is something to be navigated rather than simply inhabited. Voss found Dana at the nurse's station without asking anyone for directions. She walked straight to her, extended a hand and said, "Dana Collier, Sheila Voss. We have about 20 minutes before this floor gets busy, and I need those 20 minutes." Dana shook her hand. "Conference room at the end of the hall," she said. "It's empty." They walked there together. Dana closed the door. They sat across from each other at the small table, and Voss set a manila folder on the surface between them, but didn't open it yet. She looked at Dana with the direct, calibrated attention of someone conducting an assessment they've been preparing for. "I know what you did this week," Voss said. "All of it. The Admiral briefed me last night." She paused. "I also know about Landstuhl, about Eddie Reyes. I know your service record, your deployment history, your commendation from the 3rd Special Forces Group in 2012 that you never told anyone about, and that is buried so deep in your file that someone would have to be specifically looking to find it." She held Dana's gaze. "I was specifically looking." Dana didn't respond to the commendation. She filed that away and kept her eyes on Voss. "Why?" "Because 6 weeks ago, before any of this started," Voss said, "I submitted a proposal to Naval Special Warfare Command for a program. A small unit, specialized, embedded within VA and military medical facilities, focused specifically on disorders of consciousness in combat veterans, traumatic brain injuries, blast-related neurological damage, cases like Kyle's where the standard clinical model fails the patient." She opened the folder and turned it so Dana could read the top page. "We lose people who aren't lost. We've been losing them for 20 years. Someone with a diagnostic tool that was designed for peacetime civilian populations runs a standard assessment on a combat veteran whose brain has been rewired by pressure, blast, oxygen deprivation, stress hormones at levels that civilian medicine doesn't account for, and the tool says, 'Gone.' And we believe the tool." Her voice didn't rise, it got more precise. The program would change that. Small team, 2 neurologists, 3 specialized nurses, embedded resources for imaging and assessment, mobile enough to deploy to any VA facility in the country. She paused. I've been looking for people to build it with. Kyle's case just proved the concept. Dana read the top page of the proposal. She read slowly because she didn't want to miss anything, and also because she needed a moment to process what was happening in the space between Voss's words. This was not a coincidence. Voss hadn't reached out yesterday on impulse. The text, "We need to talk," had come within hours of Torrance's formal documentation of Kyle's reclassification. Voss had been watching this case. She had been watching Dana. "You knew about Kyle before I did," Dana said. "I've known about Kyle since he was admitted," Voss said. "He was my operator. I put him in that training program. I put him in the water." She said it without flinching, but the weight of it was there, carried in the flatness of her voice the way weight gets carried when you've learned to distribute it. "When the hospital told me he was vegetative, I read every study I could find. I knew the standard assessment was wrong, but I didn't have what you have." She paused. "The clinical standing, the documentation methodology, the ability to walk into that room and build a case that a neurologist like Torrance would take seriously." She looked at Dana steadily. "That is a specific and rare capability, and I want it in this program." Dana set the folder down. She looked at the table for a moment, then she said, "Portsmouth Naval Medical Center." Voss nodded slowly. "The Admiral mentioned he'd floated the idea." "He asked me to join a team there," Dana said. "He didn't have specifics. I didn't know what shape it would take." She looked up. "Is this what he meant?" "He and I have been talking about this program for 3 months," Voss said. "We've been waiting for the right person to anchor it clinically." She held Dana's gaze. "You spent a week in this hospital and you did what 4 months of institutional medicine could not do. You saw a person that everyone else had agreed to stop seeing. That is not a skill. That is a calling. And this program needs someone who has it." Dana was quiet for a long moment. The conference room was still. Outside the door, she could hear the ward beginning to come alive. The shift change sounds, the first carts, the low hum of a hospital waking up. "Before I answer anything," she said, "I need to be on the floor. It's Kyle's first morning with a confirmed minimally conscious diagnosis on his chart, and I want to be there when the day team comes in." Voss looked at her, and the corner of her mouth moved in something that wasn't quite a smile, but was close to respect. "Of course," she said. "We're not done talking, but go." Dana went. She arrived at room 712 at 7:49. The Admiral was already there. She had stopped being surprised by this, sitting in his chair with a cup of coffee that had gone cold, and a stillness that was different from the stillness of the past 4 months. Less like a man bracing against something, and more like a man who had finally been allowed to put his feet on solid ground. He looked up when Dana came in. "He had a good night," the Admiral said. The night nurse said his breathing pattern changed around 2 in the morning, more regular. She said it seemed different. He paused. "Better." Dana moved to the bedside. She looked at Kyle's face, then his hands, then the monitors. The overnight vitals were stable. His eyes, which had been mostly still for 4 months, were moving slightly beneath the lids. Not REM, but not the locked stillness of before. She leaned in. "Kyle, it's Dana. Good morning." 3 seconds. Then the left ring finger curled once, and there was something in the quality of the movement that was different from the careful, effortful responses of the past week. It was still small. It was still slow, but it had less of the quality of a person pushing against a wall and more of the quality of a person reaching toward a door. Dana exhaled. She made her notes. She turned to the Admiral. "The MRI is scheduled for this afternoon. Torrance wants to be present for the read. Whatever the imaging shows, it's going to give us the clearest picture yet of what we're working with in terms of the neurological damage and what pathways are still viable." She paused. "I want to prepare you for the possibility that the imaging shows significant structural damage. The responsiveness we've documented doesn't tell us about recovery ceiling. It tells us he's present. It doesn't tell us how far present can go. The Admiral looked at her. You're telling me not to mistake a beginning for a destination. Yes. He nodded slowly. I've run enough long operations to know the difference. He looked at his son. But a beginning is more than I had on Monday. Yes, Dana said. It is. At 8:22, the twist arrived, and it arrived with the particular cruelty of twists that come just when you've allowed yourself to believe the worst is over. Patricia appeared in the doorway of room 712 and said, in a voice that was carefully measured, Dana, outside please. Dana came out. Patricia closed the door behind them. Her face had the look it got when she was delivering something she'd spent 30 seconds composing on the walk over. The nursing board complaint, Patricia said. Dana stiffened slightly. I thought it was flagged for counter review. It was. It has been. Patricia paused. Harwell added to it this morning. He submitted a supplementary statement at 6:45 before he came on shift, which means he wrote it at home. Last night. She held out her phone, which had an email open on it. He's walked back the Landstuhl argument. He's not going after your prior record anymore. She paused. He's arguing that the sessions you conducted with Kyle this week, the word discrimination tasks, the bilateral response protocols, were not standard CRSR methodology, were not sanctioned by the attending, and constitute unlicensed independent clinical assessment. He's framing it not as overreach this time. He's framing it as scope of practice violation. Dana read the email. She read it twice. The argument was, she had to admit, considerably more sophisticated than his first attempt. He was right, technically, that the tasks she'd use were not within the formal nursing scope of practice in Florida as strictly defined. She had built the framework from the Cambridge research. She had adapted and applied it without physician supervision. In a strict reading of the nursing board regulations, what she had done fell into a gray zone that could, with the right framing, be painted as practice that exceeded a registered nurse's authorized scope. He's not wrong about the letter of the scope, Dana said. I know, Patricia said. He is wrong about what it means for Kyle. I know that too. Patricia took her phone back. Dana, if the board acts on this, they could suspend your license pending investigation. It could take 6 to 9 months. And even if you're ultimately cleared, the investigation itself becomes part of your record. She held her gaze. You need a lawyer. Today. Dana looked at the door of room 712. Through the small window in the door, she could see the Admiral, still in his chair, leaning slightly forward now, talking to his son. She could see the shape of his mouth moving with words she couldn't hear, and she could see, at the edge of the bed, Kyle's left hand. And the finger was moving. Not in response to a command, not in a session, just moving. A slow, small, rhythmic curl and release, like a hand keeping time to a frequency only it could hear. Like a person listening. Dana turned back to Patricia. Get me the name of the best medical licensed defense attorney in Tampa, and then get me Ellison. Patricia pulled out her phone. Already looking. Ellison was in his office by the time Dana reached him at 8:51, and he had already seen the supplementary complaint because Harwell had copied administration on the submission. Another strategic move, forcing the institutional hand. Ellison looked at Dana when she came in, and she could see that he was operating in a mode she hadn't seen from him yet. Not the careful, neutral mode of an administrator managing competing interests, but something slightly more human, slightly more committed, as if the events of the previous day had moved something in him that the weight of institutional management usually kept in place. He filed before business hours, Ellison said, from outside the building. I know, Dana said. That is a physician using the regulatory system as a personal weapon, Ellison said. His voice was even, but the words were not even words. They had edges. I've been in administration for 16 years, and I have never once seen an attending file a board complaint at 6:45 in the morning the day after his diagnosis was overturned. He paused. I'm going to support you on this. Formally, in writing, I'll submit a statement to the board describing the clinical context, the outcomes, and the institutional endorsement of the independent evaluation that validated your observations. He looked at her directly. What you did this week was not a scope violation. It was innovation under pressure. There is a difference, and I intend to make sure the board understands it. Dana looked at him. Why? He seemed slightly surprised by the question. Then he said, because yesterday afternoon, I watched a young man try to say his father's name for the first time in 4 months. And the only reason that happened was because you were in this building. He paused. That's why. The board notification arrived at 9:34. Dana read it in the break room with a cup of coffee she didn't drink. The complaint had been formally received and assigned a case number, which meant it was active. Investigation pending. She had 30 days to submit a formal response. Her license was not suspended, not yet, but the investigation was now on the record and would remain there regardless of outcome. She set the notification down. She picked up her coffee. She held it in both hands and she thought about what Voss had said in the conference room that morning. The commendation she'd never told anyone about. The proposal in the manila folder. Portsmouth, a program built for exactly this, for the cases the standard model couldn't see. She thought about what it meant to do this work inside a system that could punish you for doing it right. She thought about Eddie Reyes. She thought about Kyle Merritt's finger moving to the rhythm of his father's voice. She put the coffee down. She stood up. She went to find Voss. Voss was still in the conference room at the end of the hall, which told Dana that she had not gone anywhere, which told Dana that she had expected this conversation to happen more than once. Voss looked up when Dana came in and pushed the door closed behind her. Harwell filed a supplementary complaint this morning, Dana said. Scope of practice. It's active. Voss was quiet for exactly 2 seconds. What do you need? I need to know if the Portsmouth position comes with institutional backing from Naval Special Warfare Command. Not just program support, actual institutional standing. The kind that a nursing board investigator has to take seriously when they're evaluating whether what I did constitutes a violation or constitutes an emerging clinical methodology being applied in a specialized operational context. Voss looked at her with something that was close to approval. Yes, she said, it does. The program would operate under DoD Medical Research Authorization. Your methodology would be classified as applied clinical research within an authorized investigational framework, which means the scope of practice argument for anything conducted within the program's protocols effectively doesn't hold. Dana took that in. The sessions I ran with Kyle this week, before the program exists, are being defended by Ellison and Torrance, both of whom have institutional standing that exceeds Harwell's, Voss said. Your future, going forward, is what we're talking about now. And going forward, I can protect it. She paused. If you say yes. Dana looked at the table. She looked at the folder, still open in front of Voss. She looked at the first page. The program description, the mission statement, the list of VA facilities they plan to embed in, the preliminary list of cases already identified that fit the profile. She counted 6 names on that list before she stopped counting. 6 people who might be where Kyle had been a week ago. 6 people that the standard model had looked at and decided were gone. She said, when do you need my answer? I needed it yesterday, Voss said, but I'll take it today. Dana looked at her. Yes, she said. Voss nodded once. She closed the folder. She extended her hand across the table and Dana shook it. And that was the beginning of the next thing. The MRI results came at 3:17 in the afternoon. Torrance had the images on his tablet, and he went through them with the Admiral in the small family consultation room down the hall from Ward 7, with Dana present and with Patel present, because Patel had earned his seat at this table, and everyone in the room knew it. Torrance explained what he was seeing in language that was technical where it needed to be and plain where it needed to be, which was the mark of a physician who respected his audience. The damage was real, significant. There were areas of the brain, particularly in the left motor cortex and in portions of the frontal lobe, where the hypoxic injury had left marks that would not fully resolve. Torrance was honest about this. He did not soften it. The road to any meaningful functional recovery would be long. It would require intensive neurorehabilitation. It would require resources and commitment at a level that most families found overwhelming. And there was no guarantee, no clean, reassuring guarantee of where that road ended. The Admiral listened to all of this without interruption. He sat with his hands folded on the table, and he listened the way a man listens when he has spent his life making decisions based on hard information in difficult circumstances, and he is not going to stop doing that now. When Torrance finished, the Admiral was quiet for a moment. Then he said, "What does he need?" "The best neurorehabilitation program in the country," Torrance said, "and time, and people around him who refuse to give up on him." He paused. "He already has at least one of those." The Admiral looked at Dana. She looked back at him and said nothing, because there was nothing to say that the week hadn't already said more clearly than words could. At 4:45, Dana went back to room 712 for what she knew would be one of the last times as a nurse on Ward 7. Her assignment at this facility was coming to its natural end. She had a conversation scheduled with Patricia tomorrow about the formal close of her travel contract, and she had a conversation scheduled with Voss next week about Portsmouth. The logistics would take time to work out. There would be paperwork and a board response and a transition period that would be both complicated and necessary. But in the way that matters, in the way that her feet knew where they were going and her heart knew why, she was already on her way to the next thing. She sat in the chair beside Kyle's bed. She sat the way she had sat the very first morning she came in, when she hadn't been assigned to this room and hadn't had any official reason to be here, and had come anyway because something in the way he'd been lying there had spoken to something in her that knew how to listen. "I want to tell you something," she said to Kyle, "and I need you to hear it, not as a patient, just as yourself." She paused. "You did this. I want you to understand that. I could see what was there, but I couldn't put it there. You were fighting the whole time. You were holding on the whole time. In the dark, when nobody was looking, when everyone in this building had agreed that you were gone, you were still in there, and you were still pushing." Her voice was steady. "That is the most remarkable thing I have ever witnessed in 20 years of doing this work." She looked at his hand. The ring finger curled once, held longer than usual, released. She pressed her hand over his, briefly, and this time she didn't immediately take it away. She held it there for 3 full seconds, which was 3 seconds more than protocol strictly allowed. And she didn't care, because some things matter more than protocol, and knowing the difference between those two categories was what had brought her here in the first place. At 5:08, the door opened. It was the Admiral. He had Kyle's younger sister with him, a girl of about 22 named Callie, who had the same jaw as her brother, the same directness in her eyes, and who had driven down from Gainesville when the Admiral had called her last night with the news. She came in quietly, moved to the right side of the bed, took Kyle's right hand in both of hers, and looked at his face for a long time without saying anything. Then she said simply, "Hey, I'm here. I told you I'd come," and she sat down beside him, still holding his hand, as if she had been doing it all her life and intended to keep doing it. Dana stood up and gave the Admiral the chair. He took it with a nod that carried more in it than most speeches. Dana moved toward the door. She stopped at the threshold, not because she had something to say, but because she needed one more second with this room. This room that had been, for 6 of the most significant days of her professional life, the place where the line between lost and found had been drawn and redrawn and finally held. She looked at Kyle Merritt. His eyes were closed. His chest rose and fell with the ventilator's rhythm. His left hand rested on the bed between his father and the space where Dana had been sitting. And even now, even in the quiet of late afternoon, with the monitors holding their steady count, and his family gathered around him, and the world outside going on at its ordinary pace, the finger moved. Just once, just slightly, the smallest possible declaration of presence. Dana walked out. She walked down the hall of Ward 7, past the nurse's station where Patricia was writing notes, past the rooms of the other patients she had tended all week, past the break room where she had drunk cold coffee and built the case for a life. And she walked with a particular quality of motion that belongs to a person who knows exactly what they have done and exactly where they are going next, and who carries no doubt in either direction. The nursing board complaint was on the record, and she would answer it. Harwell was still in the building and would have to live with what he'd nearly done and what he'd finally, grudgingly, chosen to do instead. Torrance would submit his formal case review to the neurology board by end of week. The program at Portsmouth was a framework, not yet a floor, and she would help build it board by board. Kyle Merritt had months of the hardest work of his life ahead of him, and the outcome of that work was not guaranteed and never would be. None of that was the thing. The thing was simpler than all of that. The thing was a ring finger on a left hand, curling in a room that everyone had agreed was a room where nothing moved anymore. The thing was a father hearing his son's voice for the first time in 4 months. The thing was what happens when one person refuses, quietly, stubbornly, at personal cost and without drama, to accept an ending that isn't true. Dana Collier pushed through the door at the end of Ward 7, walked into the stairwell, and started climbing. Not because climbing led anywhere faster, just because she needed to feel herself moving upward, towards something she could not yet fully see, but had never once stopped believing was there. She climbed 3 flights and came out into the late afternoon of a hospital building that did not know what had happened inside it this week, and would not, in the way institutions don't know the particular weight of the moments they contain. She stood at the window at the end of the 3rd floor corridor. She looked out at Tampa in the early evening, the light going gold and horizontal the way it does in Florida at this hour, laying itself across everything without preference. The parking lot, the street, the building across the way, the sky above all of it, indifferent and beautiful. She thought about Portsmouth. She thought about the 6 names on Voss's list. She thought about the program that didn't exist yet, but would, because the need for it was not abstract, and the proof of what was possible was lying in a bed 3 floors below her, with his family's hands over his. She took out her phone. She found Eddie Reyes's number, the number she'd gotten from his brother 3 days ago, the number she hadn't yet called. She pressed it. It rang twice. "Dana," Eddie said when he picked up. His voice was warm and entirely, completely alive. "I heard it went well." "It did," she said. "I knew it would." A pause. "You doing okay?" She looked out the window at the city going gold. She thought about the word okay, what it means when you've spent a week on the edge of something that could have gone either way. And when it went the right way, you're still carrying all the weight of the possibility that it might not have. She thought about all the rooms she hadn't yet walked into, all the patients no one had yet decided to fight for, all the fingers that hadn't yet moved because no one had yet asked them to. "Yeah," she said, "I'm okay." A pause. "I've got more work to do." "You always do," Eddie said. "That's why you're the one doing it." She smiled. She said goodbye. She hung up. She put the phone in her pocket. She turned from the window and walked toward the elevator, toward the parking lot, toward the evening, toward Portsmouth, and the program, and the 6 names on the list, and every name that would follow. Because a person like Dana Collier doesn't stop when the immediate battle is won. She stops when the work is done. And the work is never done. It just becomes the next room, the next patient, the next ring finger on the next left hand, the next small and magnificent declaration that someone is still in there, still holding on, still waiting for someone with the courage to believe it. Dana Collier was that someone. She always had been. And now, finally, the world had the paperwork to prove it.